want to go over a quick case study with you, but instead of a diagnosis, we're just going to talk about pain. So not sure how long you've been following me, but if you've been following me for a while, you'll know that I'm not a big fan of talking about pain, evaluating pain, definitely never treat pain. So this is why. So this case study should tell you why pain is the last thing that we should worry about. It's the last thing that we should ever try to treat, because it's the last thing that occurs in the progression to injury. Okay, so I had a patient come in, 65, 70-year-old patient, history of a left hip replacement approximately 10 years ago that he still has pain with, 2 lumbar fusions approximately 7, 8 years ago that he still had pain with after the fusions, some knee issues, fairly active, actually pretty active guy. And I think it was 2 to 3 years ago, he was still having pain, did the surgeries, did the pain medication, did physical therapy, did massage, did chiropractic, did all the rigmarole that everybody does and nobody gets any better. He did all that stuff. And he said he was online or something, something popped up, an article popped up about how this place in Boulder, Colorado. Now, if you know anything about Boulder, Colorado, it's the woo-woo capital of the world, hippie, like way out there junk. If you want that stuff, Boulder, Colorado is your place, okay? So he found this place, PT clinic, I think it was a PT clinic in Boulder, Colorado, that came up with some new pain treatment strategy. And so he was down to do anything because he thought he had tried everything already. So goes to this place, takes part in their 2 to 3 times a week for 6 months, whatever program. And he said, you know what? It's the closest thing. It's got me the closest to being pain-free than anything else had ever done. So he was all in on this pain control system. So, and he's starting to go over my limit as far as subjective is going. So I cut him off, get to the four important questions and think, okay, I'll ask him more about this as I'm going through the treatment. So cut him off, do functional evaluation. He's got a lot of issues, really struggles with squats, struggles greatly with single leg squats, toe touch. For having a 2-level lumbar fusion, not terrible. Trunk rotation, not good at all. So anything with transverse plane, anything with single leg stance is not good. And as he's going through this, he's like, yeah, that's painful. And I'm thinking, well, wait a second. I thought you did this thing that got rid of your pain. So I hold off and wait for that until I get him on the table. So get him on the table, start going through NFTs and palpations as I normally do. Don't tell him what's going to happen. He was referred by a patient who said, you need to go see these people at 180 because they do magic and I can't explain it. So he's anticipating this great thing happening, but I didn't tell him what the great thing was. So I treat probably 2 things. And he already looks at me and says, this is different. I said, yep, hold on. I'll explain what's going on here in a second. So I went through like 2 more things and he was finally like, okay, I know you're doing something, but I don't know what's going on, but whatever it is, I can definitely feel a difference. And I said, okay, so go through patient education with him, neuromuscular facilitation, strong, weak, range of motion, all that kind of stuff. And he's like, wow, that's fantastic. So then I wanted to get more information about this pain control thing that he went through. So turns out it's more of like a meditation type thing. So he basically told me that it's mental training to get you to not think about pain. Okay. So I told him, well, that's nice that it got you comfortable, but it didn't solve your problem. So you're still here and you're still in pain. And you noticed when I had you doing those things during the screen that you struggled. He said, yeah, I struggled and I had pain. I said, okay, so what you tried before helped you out, made you happy, let you do a little bit more stuff, but it didn't fix the problem. So you've actually been more active with the underlying problem still going on. So do you think you're getting better? And he's like, well, now that you're telling me this and you're showing me what you're doing, I'm wondering if I just made my problem worse. Boom. Okay, so this guy gets it. So I said, So I'm going to give you exercises, go through the purpose of the exercises, what they're going to look like, what they're going to feel like, how often he's going to do all that stuff. And I said, if you think this mental training thing helps, I don't care if you try to, put pain in the back of your mind and move forward. But what I want you to do is pay attention to what you're feeling like. And instead of going to this meditative thing, go without it and see how it goes. So see if the exercises following what I'm doing here actually gives you increased function, better stability, more range of motion, better strength, and oh yeah, my pain also goes away. So we get through everything. He's all in. Get him up, do the screen. He has great transverse plane motion. He can trunk twist. He can shoulder, arms up over, back behind, head turn, all that stuff. Single leg squat, much better. He says, wow, he said, I feel like my muscles are actually engaged, which is exactly what we're looking for. So long story short, and the whole purpose of this to talk about pain. So when people come in and talk about pain, they're talking about the very last thing that happens. You have to have neuromuscular inhibition first. You have to have misfiring after that. You have to have instability after that. You have to have inappropriate pressure put on connective tissue after that. Then you get swelling, then you get pain, then you get all of the symptoms, okay? So if you start there with your treatment, you're going to strike out. So what did I do? I started with the root cause, which is neuromuscular inhibition. And then all the secondary stuff went away in a half an hour. And now he has normal function, range of motion, strength, stability, all that stuff, and doesn't have pain. That's the important thing. So I told him that's nice that for the last 2 or 3 years, whatever it is, that you were able to train your brain to, decrease your attention to the pain. But I don't want you to do that. I want you to understand that when pain comes on, what I want you to think about is, what was I doing? What position was I in? If the pain went away, what did I do? What position did I get in? What range of motion did I go through to get rid of the pain? Okay, and report that back to me, and then we'll move forward from there. Okay, so this is an excellent example of how people can decrease pain. So in his situation, he used mental training, meditation type things. Other people use K-tape or Bengay or stretching or foam rolling or whatever they use, anti-inflammatories, pain medication, injections, all that stuff. All that's doing is dancing around pain at the end of the progression of injury instead of getting to the beginning of the progression of injury to get rid of the root cause. Okay, so fantastic example. Hopefully that makes sense to, especially those of you who haven't been following very long and you haven't heard me go through what causes pain and where that fits in and what the progression to injury is. So now you know. So think about that when your patients come in, and that's why I don't waste time talking about pain, because I know that doesn't matter. What matters is root cause. Then when you go reassess, then you can listen to them talk about how the pain changed locations, changed the position that they were in, changed whatever. As long as that changed, you just won. Okay, as long as the pain moves somewhere else, and when they come back in the next time, they say, well, my pain went from there to over here. Fantastic, win. Reassess, treat, re-educate, change up their home exercise program. Then pain should move to a different place or pain should go away. So even if they leave with pain, I don't care. The best thing that you can have happen is have a patient come in with 8/10 pain. You get done treating them. The pain goes to 3/10 pain, and you say, fantastic, go home, do your stuff. They go home, do their stuff, and either the next day or 2 to 3 hours after they leave, they say, you know what? The pain went from a 3 to a 0. That means you made physiological changes that got better with activity, with ADL, which means if they keep doing what you gave them, problem solved. And now they have a tool. If the pain comes back 2 months from now and they're not seeing you anymore, they have a tool that they can use to get things reset and get to the root cause themselves, and then the pain goes away. All right, so hopefully that made sense. Post questions if you got questions on that. I'll see you guys later.